Hi, I'm Michael Liu. I am Professor of Obstetrics, Gynecology, and Public Health, and Director of the Preconception Care Clinic at UCLA. I'm going to talk to you about how to monitor your fertility cycle. Now, besides using ovulation prediction kits, there are two other ways to monitor your fertility cycle. It's by monitoring your basal body temperature and your cervical mucus. Now, your basal body temperature will go up by about half to 1 degree Fahrenheit about a day or two after you ovulated. The advantage of monitoring basal body temperature is that it's free. The disadvantage is that because the rise occurs after ovulation, so you can't use it to time your sexual intercourse. The other way to monitor your fertility cycle is by checking your cervical mucus. Now, for most of the month, the cervical mucus is sticky, pasty, and scant. But when you start approaching ovulation, it becomes wet and creamy. Okay? And by the time the cervical mucus gets to be watery, stretchy, you can actually stretch it up to an inch, okay? And looking like egg white, okay? Ovulation is coming. And if you're trying to get pregnant, that's when you should have sex. Okay? Now, the advantage of checking cervical mucus is that it's free and you can actually use it to time your sexual intercourse. The disadvantage is that it's sometimes confusing. For example, it can be confused with a vaginal infection, and that in some women who appear to have what looks like fertile cervical mucus, they could actually not be ovulating, as in the case of many women with polycystic ovarian syndrome. There are several other ways by which you can monitor your fertility cycle. For example, you can monitor changes in the position of your cervix, increased sexual desires, breast tenderness, or mid-cycle ovulatory pelvic pain called Mittelschmerz. In practice, I haven't really found any of these to be all that useful. But if you are monitoring your basal body temperature and checking your cervical mucus consistently for about 3 to 6 months, you'll get a pretty good idea when you're going to ovulate, especially if you have regular cycles. And you can use that information to help time your sexual intercourse. So let's say if you know that you're going to ovulate on day number 14, then I would advise having sexual intercourse on days 9, 11, 13, and 15 to maximize your chance of getting pregnant from that cycle. Thanks for watching. You can get more information about these topics in my book, Get Ready to Get Pregnant. Now remember, if you're planning to get pregnant, go see your doctor first.